Thanks for coming again this morning. We're here as part of our usual routine to meet with the press on Wednesdays, and our communication plan has also continued to involve sending out an email to our internal staff and to media and community partners with information about what's been going on during this crisis. And when we first set out to do this, we were anticipating a very large surge, that the potential would exist for the hospitals and health systems resources to be maxed out, to be swamped, and thank goodness that that has not materialized. It's in large part due to the community and the state taking to heart the social distancing, and we have not seen the surge that we were anticipating. And so at some point in the probably near term, we're looking forward to returning to kind of a more normal pace of communication, knowing that that crisis piece has probably passed. We do think that the conversation in large part is beginning to turn towards how do we begin to reopen businesses, and how does the community get back to something that that begins to feel a little more like it used to. And that's a really important discussion to have, and it's going to be extremely important that our community and our state and all of us together act responsibly as we begin to open up. So just a little bit of a recap on what we were able to accomplish as we were anticipating this huge surge. We instituted a lot of different changes, including went from a capacity of 30 ICU rooms up to a capacity of 70. We were able to secure ventilators to accommodate most of those ICU rooms. We set up protocols in our emergency department to handle COVID positive patients as they were transferred in. We set up testing stations, the drive-through testing, and then a respiratory clinic, and we've now developed an in-house testing capacity. We are so thankful that we believe we have passed the peak, and that peak was more like one of our Flint Hills rather than a Rocky Mountain. And although we love both of those, but pleased that surge was not as large as once anticipated. As we think about moving to opening businesses, and as we think about as a health system beginning to plan to begin to offer some elective services, then there are many of the same factors that we've been previously talking about that come to the front again as far as being critical, and that's the amount of testing, being able to test patients, and so that we can take care of them safely, and for both staff and patient, making sure there's enough PPE as we reopen. But also, as you might imagine, as businesses reopen, they're going to be in the market for PPE, and making sure that they have appropriate PPE, and that the competition for those supplies does not drive us all into another scarce position. The ability to do contact tracing. So we've had that ability and expertise in-house. The Shawnee County Health Department does a great job with that, and KDHE. But as businesses open up again, we're going to want to have even more ability to do the contact tracings for those that get exposed at various businesses. I mentioned we got our in-house testing. We have received our in-house testing unit, and that capacity is up and running. We're severely hampered by the lack of supplies to do the testing, the reagents and test kits. We had an order that was supposed to be here and got reallocated again, reprioritized to some other area. We don't know where. We're in contact with the vendor. We have a call tomorrow with them. We've talked with the governor and others about this reprioritization that occurs. And we understand that there are hot spots, but we also know that we have the need here, and especially as we begin to think about reopening. That testing, when we do it in-house, the results are available within about 45 minutes to an hour, so it becomes much more convenient and will facilitate testing of patients as we bring them in for elective procedures. Testing has been a big part of what has, I think, dampened the curve. It's been a piece of managing the surge. We've done now, or we had as of yesterday, done 2,249 COVID tests, and we believe that's a big part of supporting our county and our community. I didn't bring that with me, but that is in part put Shawnee County as, I think Shawnee, Wyandotte, and Leavenworth counties had the most testing done per 1,000 of population, and again, across the state of Kansas. And again, I think that has helped us to dampen out what would have been a big surge. We have today 93 of our team on exposure leave. We take, again, all the COVID positives very seriously and do the contact tracings, and then take those team members and put them on exposure leave so that we can safely return them back to work after they've gone through a 14-day period with no symptoms. I want to give a big shout out to Kent Lammers, I think is how you pronounce his name, or Lammers, Kentlammers. He's the president and CEO of Polo Custom Products. They have helped out at no expense to us in repairing our PAPRs. PAPRs are a special kind of a hood and filter that providers wear when there's the highest risk of conveying the virus. That's when they're doing a procedure or a procedure on a patient that risks the aerosolation of the virus. So they have been helping a great deal in repairing the hoods, which with use become worn, and while we await the new PAPRs that are on their way. We've had over 200 individuals and organizations donate to the institution over this period, and again, we're just very grateful for all of this great assistance and having a community and a state that has so well taken to heart the social distancing and has flattened the curve. So again, just to recap, it feels as if the story is kind of moving to a place of how do we now begin to reopen and re-engage socially in an appropriate and responsible fashion. So with that, we'll take your questions.
With the state planning on opening up on May 3rd, do you have any fears of people interacting again that it might put pressure on the hospital again? What's kind of your thought on that?
So yes, we have a concern, but I believe the state and county resources are also concerned about that, and will act responsibly. I saw a graph, so saw this on Facebook, and then it was reproduced for me today in an email of, this is what the surge would have looked like. This is what it did look like, and the commentary is, well, see, we told you it was just a hoax, or it wasn't going to be as bad. So there's a little bit of that we just need to remember that the social distancing was a big part of what helped to slow the surge or dampen the surge, and we need to keep that in mind as we go forward. There have been a lot of conversation about, as we relax the social distancing standards, will there be another little wave? Probably. We believe we'll be able to handle it with the things that we put in place, the flexibility of our staff and the expanded ICUs. It's not likely to be the kind of surge that we were anticipating when we first started down this path. There is also concern about what the winter looks like as we get into flu season. If we all continue to wear these masks, and if we continue to at some level of social distancing, that should dampen the flu season too, and that'll be a big help come winter. So.
Dr. Norman said that,
Yes.
that if we don't find a vaccine, that it could come back in the fall. Do you guys have anything in mind to prepare for that happening, a big wave coming again?
Exactly. So that's that maybe a third wave. So we've experienced the first. A second little blip may happen as we all get out and start to socialize again. Although I think people have really taken it to heart and will do it responsibly. So that it's that third wave in the fall and winter when the flu is bad again, and when the flu season kicks off, and that we have a concern about what that will look like. And we're hoping that the social distancing, the wearing of masks, will help dampen that as well as the COVID. So yes, we have a concern, and yes, we believe the preparations we put in place will carry us through that time as well.
So do you think we'll have to be wearing masks and everything going through that, or?
I don't know. I think we might. I think we might still be wearing masks.
Of course, we've heard about how crucial testing may be moving forward.
Yes.
How crucial will that be, and what level do you think testing needs to be at to continue to keep things kind of under wraps?
That's a great question. So I think testing is vital, both for surveillance and for the safety of the healthcare workers. So as we go forward, as we begin to think about doing, again, elective procedures that we've been kind of putting off, then testing of those patients, testing of visitors, testing of becomes really important to know, the level of the activity of the virus in the community and the specifics of any individual patient. So it'll become very important. I believe what we're seeing is that testing is becoming more and more available, and that's good and important. We're looking forward to the day when it's universally unlimited.
And the FDA recently approved some at-home testing kits.
Mm-hmm.
Are you encouraging people to use that to kind of take the pressure off the hospital from doing that?
Actually, we just haven't evaluated that yet, so I don't know whether I can encourage that or not.
You guys mentioned in the daily update yesterday that you guys are screening some patients at Stormont Vail sausage plant at Holton. Is that a precautionary measure because of some of the other outbreaks that have occurred at meat packing plants in other counties?
Actually, I'm not really able to talk about Johnsonville at this point. Yeah.
Is there any update on the clusters? I mean, team members here that have tested positive, is the number going down?
Yeah, so the number's pretty stable.
Do you know that?
Yes, so I think we're at 15 total, and I don't believe that has changed. And so 14 employees and 1 provider.
The Kenagy is listing some new symptoms as possible signs. They're not saying that fever is as much of a sign, but other symptoms as far as like cold and all of that.
Uh-huh.
Are you guys, have you been updated on that? And then also, how does that become apparent to you guys? Does Kenagy send you an email to say, look for these symptoms now? Yes,
so we're in constant contact with KDHE and the Shawnee County Health Department, so we get multiple emails daily. So we're updated regularly.
And so now you're looking for those new symptoms?
Mm-hmm.
Do you have any words of encouragement for the community since the surge was not what we expected?
Boy, yes, indeed. So pat each other on the back. I'll do it from 6 feet away. It's been a tremendous effort. People have sacrificed a great deal, and we believe it's worked. And so the message isn't, it wasn't a big deal. The message is, way to go, thank you, and let's all continue to act responsibly.
Would you be able to describe what it's like for someone that is hospitalized here with the coronavirus? How do you treat that? Are they hooked up to an IV? Are they mainly just monitored?
Well, so that's a difficult question to answer. So there's gradation of the illness. So some may be in a normal medical surgical bed with normal monitoring and support with IV and perhaps some respiratory treatments, oxygen, all the way up to the very critically ill that are on ventilators and fully supported. So it's a spectrum of care.
And then in some illnesses, people don't necessarily die from the illness that they're being treated
Right.
for. Is that what happened? Is that what's happening with these patients, or are they dying from something else other than coronavirus?
Well, that's also difficult to answer because the coronavirus in its end stage causes multi-organ failure. So, and it can cause secondary pneumonias, bacterial pneumonias that can kill a person as well. So they're all kind of mixed together. The people that seem most at risk are those that have other comorbidities, heart issues or lung issues. That's a difficult question to answer. It's a kind of a mix.
And so for the patients that have passed away here from complications of
Mm-hmm.
COVID-19, do you know what they technically died from?
I couldn't tell you right now. Yeah.
Sorry.
No, go ahead.
I was just having a clarifying question about the in-house testing. You guys
Yes.
you guys have it up and running, but you said there's some supplies you're still needing, or?
Right, so we had it up running. We had initial allocation of testing kits, which are the reagents to do the tests, and the second allocation did not come, and it has not come twice. We expected it at 2 different dates, and they've not delivered it. Each time it's been reallocated somewhere else.
So this testing's kind of stalled?
It is in a very low level of availability currently.
So you guys did do
We did.
initially, no?
We did, yep.
And when someone is hospitalized here and then they're cleared, what are those signs that would give them the go-ahead to either begin treatment at home or be cleared?
Well, so the same kind of discharge criteria as any other patient, if they're able to perform their usual functions, able to eat and drink, and so they're in a state that they no longer require hospitalization, then they could recover at home. So I don't think there's any particular unique discharge criteria for a patient out of the hospital. We have recently instituted for patients that are going to facilities, like a skilled nursing facility or a nursing home, a test beforehand, before they go.
And with the in-house testing, what piece of that testing process hasn't, or you guys haven't received?
Yeah, it's the reagents, the test kits. So we've got the unit, but then to perform the test, you have to have the various reagents that go into the unit, and they come by test, and we got our first allotment, and we've not received subsequent that we were promised. Yeah.
Is the reagent, is that considered a swab, or is that something else?
So the swab is the supply that you gather the specimen, and those are in short supply, but I think we have what we need there. It's the reagents, the chemicals that create the test.
So when you guys do this test, you said it takes about an hour?
Yes.
Does the computer say, congratulations, you don't have COVID-19? Is it a printout, or how do you actually know that the particular person that had that test, what kind of notification do you guys get on that, or is it a percentage thing?
No, it's positive or negative. Yeah.
So there's either a plus or a minus?
Yeah, you either have it or you don't, according to the test.
Okay.
Yeah.
And I don't know if you've said this already, but do you know how many tests you could do a day in-house?
I didn't say that, and right now we're very limited because of the reagent issue. We hope to be able to do an unlimited number someday, but right now it's very limited.
When it was up and running, do you know how many you guys did?
Yeah, well, we can get that for you, the first allotment. We'll just get it for you.
You're not able to run on Johnsonville at all?
I am not. Sorry.
For those team members that are testing positive, are any of them hospitalized or are we still good?
No, they're all good, recovering well. Okay, thank you guys, appreciate you.